Good day, everyone. I am Renalyn Salinas, together with Danny Ringulio, and our topic is disseminated intravascular coagulation. So, disseminated intravascular coagulation, or what we call DIC, is a rare blood clotting disorder that can cause organ damage and uncontrollable bleeding. DIC is a complication of different serious medical conditions that can be life-threatening if you don't receive treatment. You may develop DIC if you have an infection or injury that affects the body's normal blood clotting process.
And for the pathophysiology, so there are two causes of the disseminated intravascular coagulation, which is the activation of the intravascular coagulation and the endothelial damage. So there are three causes of the activation of the intravascular coagulation, which is the platelet consumption and the coagulation and the fibrinolysis. So these three factors could lead to impaired coagulation and bleeding. And for the endothelial damage, it could lead to microvascular thrombosis and multi-organ ischemia or failure.
So next is the signs and symptoms. So you may experience uncontrollable bleeding from several areas of your body, bruise, dyspnea, blood clots, confusion, and fever that's more than 103 degrees Fahrenheit.
And next is the diagnostic test for the disseminated intravascular coagulation. So these are the tests. The first is complete blood count or the CBC, the partial thromboplastin time, the prothrombin time test, the fibrinogen test, and the D-timer test.
So how is DIC treated? So treatment for DIC depends on your symptoms and how serious they are. The main goals of treatment for DIC are to control clotting and bleeding and to treat the underlying cause. Your doctor may use anticoagulant, also called blood thinner, to reduce the blood clotting. You may be given them as a pill, as an injection, or through an IV.
So for the prognosis, so can someone recover from DIC or disseminated intravascular coagulation? Of course, yes, they can. Just by supportive treatments like anticoagulants and blood and platelet transfusion may stop the blood clots and hemorrhage from forming. But healthcare providers still need to treat the medical issues that triggers the DIC.